Brazilian butt lift. The Brazilian butt lift, or BBL, combines liposuction with fat transfer to enlarge and reshape the buttocks. Fat is removed from areas such as the abdomen or thighs, processed, and injected into the buttocks with cannulas. The BBL is considered the deadliest cosmetic surgery worldwide. The greatest danger is fat embolism, where injected fat enters veins in the gluteal muscles and travels to the lungs or heart, blocking blood flow and causing immediate death. Reported mortality rates are 1 in 3,000, far higher than most elective surgeries. Other complications include blood clots, infections from large wounds, fluid buildup known as seromas, and nerve damage. Because injected fat survival is unpredictable, patients often end up with asymmetry or contour irregularities. Larger fat volumes make the procedure riskier, and repeat surgeries compound the danger. Full body lift. A full body lift, often performed after massive weight loss, removes large areas of skin and fat from the abdomen, back, thighs, and buttocks, sometimes combined with muscle tightening. This surgery is extremely invasive, often lasting 6 to 8 hours, with extensive incisions encircling the torso. The long operative time raises anesthesia risks, and blood loss can be significant. Wound healing problems are common because blood supply to large skin flaps is disrupted. Necrosis or tissue death can occur at incision sites, leaving disfiguring scars. Fluid buildup under the skin, called seromas, often requires drainage. The greatest danger is blood clots forming in the legs or lungs during the long recovery period. Mortality rates are higher than for smaller localized cosmetic procedures due to the combined stress on the cardiovascular, respiratory, and immune systems. High-volume liposuction. High-volume liposuction removes 5 liters or more of fat in a single session. While standard liposuction carries risk, the danger multiplies when very large amounts are removed. Large fat extraction disrupts fluid balance in the body, making shock and organ failure possible if replacement fluids are not carefully managed. Blood loss can be significant, particularly when multiple areas are treated at once. The cannula can puncture internal organs like the intestines or kidneys, leading to life-threatening internal bleeding. Fat embolism syndrome is another risk when loosened fat enters the bloodstream. Extended surgery times raise the risk of blood clots and anesthesia complications. Because contour results depend on even fat removal, aggressive suctioning often leads to lumpy, irregular, or sagging skin, creating both medical and cosmetic complications. Rib removal surgery. Rib removal surgery is performed to reduce waist size by extracting lower floating ribs, usually ribs 11 and 12, to create an exaggerated hourglass shape. The procedure is highly dangerous because ribs protect vital organs such as the kidneys, liver, and spleen. Removing them reduces structural protection, increasing vulnerability to trauma. Surgery itself involves cutting through muscles of the chest and back, leading to significant pain, blood loss, and long recovery. Risks include infection, chronic pain from nerve injury, lung puncture causing pneumothorax, and damage to abdominal organs. Long-term, the absence of ribs leaves the torso structurally weaker, making future injuries more dangerous. Because the surgery is purely cosmetic and offers no medical benefit, it is banned or strongly discouraged in many countries. Jawline reshaping surgery. Jawline reshaping includes mandibular angle reduction, chin contouring, or full orthognathic surgery to narrow or sharpen the jaw. These procedures involve cutting and shaving bone or inserting implants. Complications include permanent nerve damage that causes numbness in the lips, chin, or tongue. Misalignment of the jaw can lead to chronic chewing problems and joint pain. Deep infections in the bone, called osteomyelitis, may develop and are difficult to eradicate. Severe swelling after surgery can obstruct the airway, creating emergencies in the immediate recovery period. Jaw fractures are possible when bone is over-reduced, and contour irregularities are common if healing is uneven. Because the jaw plays a central role in speech and chewing, complications can permanently impair function in addition to appearance. Gastric balloon for weight loss. An intragastric balloon is inserted endoscopically into the stomach and filled with fluid to induce satiety. Though less invasive than bariatric surgery, it carries severe risks when complications occur. The balloon can rupture or leak, allowing fluid to enter the intestines and cause obstruction, requiring emergency surgery. Overinflation or malposition can block stomach emptying, leading to severe nausea, vomiting, and dehydration. Rarely, balloons have caused perforation of the stomach or esophagus, which can lead to sepsis, a life-threatening infection of the bloodstream. Extended presence of the balloon can cause ulcers, gastritis, and internal bleeding. Though marketed as safe, reported deaths have led to FDA warnings and restrictions. Eyelash implant surgery. Eyelash implants transplant hair follicles, often from the scalp, into the eyelid margins to create longer lashes. The surgery is highly risky because transplanted hair grows like scalp hair, long and thick, requiring constant trimming. Improper angling of follicles can cause lashes to turn inward, scratching the cornea with every blink. This can cause corneal ulcers, infections, or permanent vision loss. Implantation into the delicate eyelid margins also risks scarring, deforming eyelid closure, and exposing the eye to damage. Infections in this area can rapidly spread into the orbit and brain, given the venous connections. Because complications can impair sight permanently, the procedure is considered especially dangerous compared to its cosmetic benefit. Face feminization or masculinization surgery. These procedures combine multiple surgeries such as jaw shaving, forehead contouring, brow reduction, rhinoplasty, and cheek implants, performed together to change overall facial structure. The danger lies in the combined surgical time, often exceeding 8 hours, greatly increasing risks of anesthesia complications, blood clots, and fluid shifts. Each procedure adds its own risks. Jaw shaving risks nerve damage, brow bone reduction risks sinus injury, and rhinoplasty risks breathing impairment. When combined, the stress on the body multiplies. Blood loss, infection, and poor wound healing become more likely. Scarring, asymmetry, and long-term nerve pain are common. Because so many procedures are done at once, it is difficult to isolate and treat complications when they arise, making recovery especially challenging. Calf implant surgery. Calf implants use silicone prosthetics placed under or over the calf muscle to increase leg size and definition. The procedure is dangerous because the calf muscles are essential for walking and circulation in the legs. Implants can compress blood vessels and nerves, leading to chronic pain, numbness, or impaired circulation. Deep vein thrombosis is a serious risk, as blood clots form more readily in the legs after surgery. Infections can be difficult to treat due to the implant's placement, often requiring removal. Implant shifting and rupture are also common, leading to deformities. Because the calves are in constant use, healing is slow and complications frequently interfere with mobility. Corset trunkplasty. Corset trunkplasty is an extreme body contouring surgery in which multiple vertical and horizontal incisions remove skin from the chest, waist, and abdomen to tighten the torso like a corset. The extensive incisions create a massive surface area for infection and wound breakdown. Blood loss is high, and surgery time is prolonged, increasing anesthesia risks. Wound healing complications are extremely common because of the tension placed on the remaining skin. Necrosis and dehiscence, where wounds reopen, are frequent outcomes. Patients often require multiple follow-up procedures for drainage, wound care, or revision. The resulting scars can be large and deforming, even when healing is successful. The extreme invasiveness of this surgery makes its risk profile far higher than more limited contouring procedures. Rib cartilage nose reconstruction. In complex rhinoplasty, surgeons sometimes harvest rib cartilage to rebuild nasal structures. While this is done for both medical and cosmetic reasons, it carries notable dangers. Harvesting rib cartilage can cause pneumothorax if the lung is punctured, leading to collapsed lung. The chest incision may become infected or scar painfully. The graft itself may warp after implantation, creating long-term deformities in the nose. Because Because the cartilage is rigid, shaping and positioning are difficult, and results are unpredictable. Extreme body modifications. Some patients undergo surgeries beyond standard plastic surgery, such as tongue splitting, subdermal implants, or removal of digits or tissue for aesthetic purposes. These surgeries are often performed outside medical systems, raising infection risk from non-sterile conditions. Subdermal implants can erode through the skin, become infected, or shift position, leaving disfigurement. Tongue splitting risks massive bleeding, infection, and impaired speech. Removal of tissue or digits creates permanent disability. Because these surgeries are rarely performed by licensed surgeons, safety standards are absent, and complications can be catastrophic. The lack of regulation and oversight makes extreme body modification among the most dangerous cosmetic procedures.